Does everybody know what legumes are? Know what legumes are? Okay. I didn't. A couple of years ago I had to look that up. Processed food, going through that really quickly, processed food is kind of the enemy. So I tell people to shop around the edge of the grocery store and skip the aisles where all the crackers and the cookies and the foods loaded with sodium and sugar are. And try and eat as close to our caveman ancestors as we can, of course avoiding red meat. Cold water fish is recommended. Salmon, mackerel, tuna, and trout are the fish that are higher in omega-3s. Increasing fiber helps to lower cholesterol and keeps you full. This I put on here when I was talking to families. But the Mediterranean diet also advocates that's very social. It does allow a glass of wine for people who like that, but it's eating as a family. If you sit by the TV with a plate of food, you tend to, and by yourself, you'll tend to eat more. When you fill out the stroke risk scorecard, if you score moderate or high, talk to your doctor about ways that you can reduce your risk for stroke. Knowing your ABCs is key. A stands for hemoglobin A1C, which is a diabetes test for your sugar. That if you're a diabetic is generally done twice a year. B is blood pressure, and C is cholesterol. So when you see your doctor, ask for your numbers. So it's called knowing your ABCs. We have some apps here. I use Strive, and I use, I don't have Fitbit, I have the Upband, and I use MyFitnessPal too. There are lots of apps. Okay, went through that. We have a program here called Cooking Matters that helps to educate people how they can cook on a low budget, healthy foods. Sometimes the challenge is they'll ask you to cook a meal for 4 people for $10. And they had this in February, and there should be another one coming up hopefully in the summer. It's a free program. We also have a couple of support groups for people who've had stroke or actually who are interested in stroke. One is Purely Support. It's the first Monday of the month, and that's held at Rand Boulevard. And that's great because some people with stroke have certain issues that come up, so other people are there to help them. The second one, the one I'm involved in, is the Stroke Wellness Club, and that's held here on the second Wednesday of the month next to the Windows Cafeteria. We invite people to come and talk on subjects related to stroke, such as nutrition, exercise, pharmacy, legal things, etc. This is the Health Fit Forward Fitness Program, and we do have flyers up there if anyone's interested. That's it, I think. Any questions? So everybody knows FAST. Good. I don't believe so. I'm hoping that we can get volunteers to help pick people up who want to come to the stroke support group, but that might be one thing we can talk to the stroke support group about. Yeah, it is for a lot of people. Yeah, getting to Rand. Mm-hmm. Yeah, geographically, if it's not in your area. So, yeah. There is SCAT Plus that you sign up for. Your doctor fills out the form. You can get the forms online and you can fill them out, and they come to your house and pick you up. So that's another option. Mm-hmm. just for everybody, right. I know I've helped people at the clinic fill out those forms and sign them. So, but you don't know until you try. Well, you know, Uber is here now, isn't it? Isn't Uber here? Uber is here. Yeah. My kids live in San Francisco, and they have it there, and it's here. Yeah. Yeah. And you can call, and they send a car. That's how my kids do it in San Francisco. Have you used Uber here?
Yeah, but it's only by app.
Oh.
Yeah, you don't call.
Oh.
Press the button, they'll come to your house, and they charge your credit card, you don't give them money. And it's cheap.
It's really cool. It's a lot cheaper than a cab. Hmm. I hope you're not videotaping that part.
I've got a question.
TIA.
Yeah, TIA versus having a stroke. Do TIAs occur around stroke, or are they always before?
Some people just have TIAs and don't have a stroke. Okay. Other people will have a stroke and never have a TIA.
You can have a stroke and TIA.
Yes.
And something right as they occur.
Right. Right.
What are, and then you answered this, what are the standard, beyond emergency room, what are the standard tests people run to review whether you have chances for high stroke or not? What would be just an MRI, or are there other?
If you come in with TIA, one of the with the TIA, your risk of having a stroke is a lot higher within the first 24, 72 hours, which is why we tell people with stroke symptoms to come in. The typical workup for that would be an MRI, echo, and check your carotids, and blood work, of course. Cholesterol, blood pressure.
Okay, so the MRI.
Yes, we'll give you a whole bunch of other stuff. Mhm. Mhm. So sometimes people at home have a TIA, they may not seek medical treatment because the symptoms went away. So
treatment you do is then you reassess for assessment of stroke, right?
Then it's management of risk factors. If you have a TIA,
Because it resolves itself, so it's not like you're fixing anything.
right, but you're reducing and you're going to try and find out why it happened. So if you have a stroke or a TIA, they're going to try and find out why did it happen. Was it because of blood pressure? Was it because of very often, yeah.
So you can tell, like, oh, it was that blood vessel or that clot.
Not that blood, but it was because of your blood pressure. It was because you had microangiopathic disease, or you've got atherosclerosis, or you have a little hole in your heart, or whatever. So it's trying to figure out why those symptoms occurred to reduce your risk factors. Did you smoke? Was it because you smoke? Was it because of atrial fibrillation? Atrial fibrillation is a little bit harder to pick up. That might take a little bit longer. So, and then risk factor modification. If you've had a TIA, you'll be on aspirin. You'll be on a statin drug, which is for cholesterol, possibly a blood pressure medication. Closer monitoring. Yeah. Yeah, I did in the beginning. Yeah.